everyone, I am Kaviya and I am working as an assistant professor in the Department of Psychology in Ratnam College of Arts and Science, and I teach abnormal psychology to the students. And today I am going to give you a lecture on the treatment of depression. Before getting into the topic, I want to give you a gist on depression, the causes of depression and its symptoms. So depression is nothing but a type of mood disorder, and the symptoms include anhedonia, which is loss of interest in pleasurable activities or fun-filled activities, and it is followed by sleeplessness. At times people will be having hopelessness, helplessness and worthlessness. It also, in addition to it, will be the patients will be experiencing lack of sleep and lack of appetite, and they will be in a low mood for a prolonged period of time. And we can diagnose a person as having depression by assessing all these symptoms in that person. Yes. So now I also have to explain about you the causes, right? So basically we can conclude, or we can include all the causes into two segments, which are biological causes and environmental causes, or else psychological causes. So in biological causes we will be having biochemical imbalances and heredity and familial contributions, whereas in environmental causes we will be seeing the stressful life events, early childhood experiences and etc. So now getting back to the topic, our topic is actually about treatment of depression. So broadly speaking, we can segregate treatment of depression into two major types, which are biological and psychological treatment. So under biological treatment we will be only concentrating on the antidepressants and electroconvulsive therapy, and whereas in psychological treatment we will be broadly concentrating on various psychotherapies, including CBT, interpersonal psychotherapy, and if needed we can also include some alternative therapies. So coming back to biological treatment, it is purely based on the chemical components that alter neurotransmitter actions and on the changes in brain activity. Only that led to the two major biologically based treatments, which are, as I earlier said, antidepressants and electroconvulsive therapy. Yes. Generally in antidepressants, generally people are using three major antidepressants, which are monoamine oxidase inhibitors, tricyclic antidepressants. So I have given you the expansions as well as the abbreviations, and the next is selective serotonin reuptake inhibitors, which is otherwise known as SSRIs. So the first one is MAIOS. They were actually found accidentally. The first MAIO is iproniazole, which was first used to treat tuberculosis patients, but that had a side effect on mood elevation in that people. So later it was introduced into the field of psychology to treat the patients with depression, and it got succeeded, and now it is used as a depressive drug to treat depressed individuals, antidepressive drug. So the next, but all the MAIOs have side effects. People who are undergoing this treatment should avoid some food items like cheese, red wine and other food items which are allergic to them. Next comes your TCAs, which is tricyclic antidepressants. The first one is imipramine, which was first used in treating schizophrenia. Later it was used as a medicine to treat depression. And next, it also has some side effects like constipation problems, heart irregularities and weight gain in some people. But for some patients, small overdoses were lethal, which were very deadly to some people if they are given overdoses. Next comes SSRIs, which is selective serotonin reuptake inhibitors. The first one is fluoxetine hydrochloride, which is otherwise known as Prozac. It is found to be effective in some cases with very less side effects compared to other two types of antidepressants, which are TCAs and MAOIs. It also has standard dosage, which is the optimum dose, which is suitable for most of the population, and as a dose is fixed for all the people. Though it has all the enhanced safety and tolerability, it has very less effect on the people who are undergoing the treatment, which is nothing but the poor prognosis. Next is ECT. it is electroconvulsive therapy. So, this is given in terms of severe depression and when the person is having suicidal ideations, and when there is a time lag between the medicine use and the prognosis. Prognosis is nothing but the improvement after recovery. And next is if a person is undergoing this treatment ECT, he will be easily recovering from the illness, which is depression. So, you can witness immediate improvement in the patients who are undergoing ECT, and it involves producing an array of electric shocks through the brain using 2 electrodes which are placed on the 2 sides of the scalp, and it is nothing but giving mild seizures which is not up to many seconds, only milliseconds is allowed. And while providing any patient with ECD, we should take the consent of the patient. If the patient is not in the position to give the consent, we should reach the court to obtain the consent, and then we can proceed with the treatment. And most of the psychologists are not provided with this ECT and medicines, antidepressive medications. And next comes the memory disturbances. So, if a person is undergoing ECT, he or she may be subjected to have memory disturbances later. Yes. So in ECT 6 to 12 sessions can be given at about 3 sessions per week, and it brings some changes in the person's hypothalamus, in the brain region, which is responsible for changes in mood, appetite and sleep. And it is also effective when a person is having delusions or some other psychotic symptoms like hallucinations and etc. And the safety of the ECT has been improved by reducing the electrical power from the older methods. Yeah, next comes the psychological treatment. Before getting into the psychological treatment, I want to give you a summary of the biological treatments. So, in biological treatments, we have seen antidepressant drugs and ECT. In antidepressant drugs, we have seen 3 types of antidepressants, which are monoamine oxidase inhibitors, tricyclic antidepressants and selective serotonin reuptake inhibitors. So, there we have seen majorly 3 drugs, which are imipramine, ipronizoid and Prozac. So, whereas in ECT we have seen the procedures and we have seen the consent and disturbances given by ECT. Next comes the psychological treatment. Under psychological treatment, our focus is on psychoanalysis. Under psychoanalysis, we have interpersonal psychotherapy, which is a short-term therapy rather than psychoanalysis. Next comes humanistic existential therapy. Here we are combining both the therapies, both the approaches, which are humanistic and existential therapy, to provide a person treatment. Next is behavioral therapy. Under that we will be seeing only the social training skills and social skills training, and next is cognitive behavioral therapy, and we can provide combination of treatments, and if needed we can give alternative therapies. Yes, here comes psychoanalysis. So, according to psychoanalysis, the causes of depression are early childhood experiences and acute external stressful events. It is merely focusing on the psychological perspective and the environmental perspective rather than concentrating on the biological perspective. And in psychoanalysis, we have 2 ingredients, which are the expression of suppressed feelings and the emotions and the support provided by the therapist. So, here comes the transference and counter-transference, right. Psychoanalytic therapists will be very directive. And next, according to some researchers, the psychoanalysis therapy is not up to the level to the patients who are with depression. So, it is comparatively less effective. Next comes interpersonal psychotherapy. It is one form of psychodynamic therapy, and it is originally found to treat reoccurrence of the symptoms of depression. If a person is after recovery, if a person is having any symptoms, that is called relapse, reoccurrence of the symptoms, and it also teaches people to be more socially effective to improve their relationships. Obviously, if Yes, obviously if a person is having depression on any sort of problems, he or she might be having some interpersonal relationship problems and etc., right. So for that purpose, interpersonal psychotherapy can be included. And so I have given you the gist about psychoanalysis and interpersonal psychotherapy in psychological treatment, and we have completed all the biological treatments. Yeah, thank you all, happy learning.